Namaste, I am JVN Dr. Priyanka BAIRWA from Faculty of Physiotherapy and Diagnostics. In this video, my topic is dimensions of health. So let's start. Health is multidimensional. The WHO definition envisages three specific dimensions: the physical, the mental, and the social. Many more may be cited: spiritual, emotional, vocational, political dimensions. As the knowledge base grows, the list may be expanding, although these dimensions function and interact with one another. Each has its own nature and for descriptive purpose will be treated separately. First is physical dimension. The physical dimension of health is probably the earliest to understand. The state of physical health entails the notion of perfect functioning of the body. It conceptualized health biologically as a state in which every cell and every organ is functioning at optimal capacity and in the perfect harmony with the rest of the body. However, the term optimum is not definable. The signs of physical health in an individual are a good complexion, a clear skin, bright eyes, lustrous hair with a body well clothed, with a firm flesh, not too fat, a sweet breath, a good appetite, sound sleep, regular activities of bowel and bladder, and smooth, easy, coordinated bodily movement. All, all the organs of the body are of unexceptional size and functional normally. All the spatial senses are intact. The resting pulses rate, blood pressure, and exercise tolerance are all within the range of the normality for the individual's age and sex. In the young and growing individual, there is a steady gain in weight, and in the future, this weight remains more and less constant at a point about the 5 pound or 2.3 kgs, more or less than the individual's weight at the age of 25 years. This state of the normality has firmly wide limits. These limits are set by observation of the large number of normal people who are free from evident disease. Evaluation of physical health. Modern medicine has evolved tools and techniques which may be used in various combinations for the assessment of the physical health. They include self-assessment of overall health, inquiry into symptoms of ill health and risk factors, inquiry into medications, inquiry into levels of activity, for example, number of days of the restricted activities within a specific time, and degree of fitness. Inquiry into use of medical services, for example, the number of visits to a physician, number of hospitalization in the recent past. Standardization questionnaires for the cardiovascular diseases, standardized questionnaires for respiratory diseases, clinical examination, nutrition and dietary assessment, and biochemical and laboratory investigations. Next is mental dimension. Mental health is not merely absence of mental illness. Good mental health is the ability to respond to the many varied experiences of the life with the flexibility and a sense of purpose. Most recently, mental health has been defined as a state of balance between the individual and the surrounding world, a state of harmony between oneself or others, a coexistence between the realities of the self and of the other people and that of the environment. Psychologist has mentioned the following characteristics as an attribute of the first is mentally health of a mentally healthy people or person. A mentally healthy person is a free from internal conflict. He is not at war with himself. He is well adjusted, that is, he is able to keep along with the other. He accepts criticism and is not easily upset. He searches for the identity. He has a strong sense of self-esteem. He knows himself. He needs problems, goals. This is known as self-actualization. He has good self-control, balance, rationality, emotionality. He has he face problems and tries to solve them that is coping with the stress and anxiety. Assessment of mental health at the population level may be made by the administrating mental status questionnaires by the trade interviewers. The most commonly used questionnaires 6 to determine the presence and extent of organic disease and of the symptoms that could indicate psychiatric disorders. Some personal assessment of the mental well-being is also made. The most basic, the most basic decision to be made in the assessing mental health is whether to assess mental functioning, that is the extent to which cognitive or affective impairments impede role of performance and the subjective life quality and psychiatric diagnostics. Third one is social dimension. Social well-being impels harmony and integration within the individual, between each individual and other member of the society, and between individuals and the world in which they live. It has been defined as the quantity and quality of an individual's interpersonal ties and the extent of involvement with the community. The social dimension of the health include the level of social skills one possesses, social functioning, and the ability to see oneself as a member of the large society. In the journal, social health takes into account that every individual is a part of family and of wider community and focus on the social and economical conditions and well-being of the whole person in the context of his social network. The social health is rooted in positively material environment, focus on financial and residential matters, and positive human environment, which is concerned with the social network of the individual. Fourth is spiritual dimension. Proponents of the holistic health believes that the time has come to give serious consideration to the spiritual dimension and to the role this plays in health and disease. Spiritual health is this in this context refer to that part of the individual which reach out the mysterious for meaning and purpose in life. It is the intangible, something that transcends physiology and psychology. As a relatively new concept, it seems to defy concrete definition. It includes integrity, principles, and ethics, the purpose in life, and commitment to someone higher being and belief in the concepts that are not subject to the state of the art explanations. Next is emotional dimension. Historically, the mental and emotional dimension have been seen as a element or as a two closely related element. However, as a more research becomes available, a definite difference in the emerging mental health can be seen knowing or cognition, while emotional health relates to feeling. Experts in psychobiology have been relatively successful in isolating these two separate dimensions. With this new data, the mental and emotional aspect of the humanness may have to be viewed as two separate dimensions of human health. Now, sixth point, which is vocational dimension. The vocational aspect of the life is a new dimension. It has part of human existence. When work is fully adapted to the human goals, capacities, and limitations, work often plays a role in the promoting both physically and mentally health. Physical work is usually associated with an improvement in a physical capacity, while goal achievement and self-realization in work are a source of satisfaction and enhancement self-esteem. The importance of this dimension is exposed when the individual suddenly lost their job or are faced with the mandatory retirement. For many individuals, the vocational dimensions may be merely a source of income. To others, this dimension represents the culmination of the effort of the other dimension as they function together to produce what the individuals consider life success. Next is other. A few other dimensions have been suggested, such as philosophical dimension, cultural dimension, socio-economic dimension, environmental dimension, educational dimension, nutritional dimension, curative dimension, preventive dimension. A glance at the above dimensions show that there is a many non-medical dimensions of health. For example, social, cultural, educational, etc. These symbolize a huge range of the factors to which other sectors besides health must contribute if all peoples are indeed to attain a level of health that will permit them to lead a socially and economically productive life. Thank you. If you have any concerns and questions regarding to this topic, please comment on the comment box. And this video is powered by digital version of 2.0 to share your video.